one item on your child's school checklist that needs to be done right now? Here's Joe.
Summer is in full swing, and we don't want to rush anything, but coming up is fall. And if you've got a teen playing fall sports, that teen is going to get a required sports physical. They need to. So as a parent, let's think about scheduling that right now. And joining us from Akron Children's Hospital is Dr. Brian Riley, a sports medicine doctor. Good to have you, doctor. Thanks for being here.
Absolutely. Thanks for having me.
So when a parent brings a teen to a sports physical, what should they expect?
Sure. So a sports physical goes by another common name, a pre-participation physical evaluation, a PPE. And that name really highlights what we're trying to accomplish when we meet with these student athletes. We get a general picture of their overall health, but we're really using the opportunity as a way to screen for illnesses or injuries that may predispose them to different issues when they play sport.
And doctor, during the sports physical, what do you typically come across that would be cause for concern for the parent and teen?
Sure. Well, at Akron Children's Hospital, we do a comprehensive medical exam, and that involves questions about the athlete's medical history, surgical history, medications, and allergies, and includes some family history as well. Sometimes might come across an asthmatic who has issues managing their asthma and might benefit from pre-treating with their rescue inhaler before exercise. Sometimes an athlete might have a lingering ankle issue and might benefit from a referral to our orthopedic surgeons or our primary care sports medicine docs at Akron Children's. And then additionally, sometimes something more serious, an athlete might report chest pain or dizziness during exercise that might prompt us to refer to our cardiologist at Akron Children's Hospital to really get a better evaluation of the heart before they participate in sport.
So doctor, is the sports physical taking place of any other checkups that are necessary for the rest of the year?
That's an important question. And while your primary care provider can certainly do a sports physical at a well visit, a sports physical is not intended to replace the importance of a well visit. So we really want to emphasize it's important to keep those well visits. Well visits are much more comprehensive, and they explore a certain teenager's mental, physical, emotional well-being as part of that visit. And the sports exam is really focused on their ability to participate safely in sport.
Well, it's very, very good. All right, very good to know. All right, so I'm curious. I want to get some insight from you, doctor. With COVID that we went through, all of us went through, what do you think is going to be different maybe this year because of all the precautions with COVID last year and what we're still taking?
Absolutely. Fortunately, as COVID numbers continue to decrease and immunizations on the rise, there's a lot of optimism that sports might look a little bit more normal this fall season compared to last fall season. Now, the one lesson we hope our athletes can take away from the COVID pandemic is we all have a role to play in keeping each other safe and the importance of hand hygiene and staying away when you're not feeling well. Furthermore, information related to COVID continues to come out, and so it's important to talk to your primary care provider to stay up to date on that information. For example, Pfizer immunizations are now eligible for athletes 12 and older, so that can be an important way to staying safe this fall when you play sport.
Great advice, Dr. Brian Riley. We appreciate it very much. For more information, akronchildrens.org/UC Sports Physicals. That's the website, okay? Or just go to akronchildrens.org and click around. You'll find it, no problem. 330-543-1000 is the number. Again, doctor, thank you so much for your time.
Thank you, sir. Appreciate it.
You bet.
This segment of It's About You was sponsored by Akron Children's Hospital.